Welcome to the second installment of our 10-part series on mastering coordination of benefits. Precision isn't just a goal in our line of work, it is the standard. Today, we are focusing on one of the most common, yet frequently misunderstood scenarios in the industry, the working aged rules. We are looking at beneficiaries aged 65 and older, but here is the critical question. If a member is over 65 but still actively employed, who pays first? In this session, we will define the strict criteria that determine primacy. We will look at employer size, employment status, and exactly how these factors shift the financial responsibility between a group health plan and Medicare. Let's get started.
When does a private insurance plan pay before Medicare for someone aged 65 or older? Look at the pivot point on the scale, the number 20. This is the critical threshold for the working aged rule. If an employer has 20 or more employees, the group health plan, the GHP, is the primary payer. As you can see, it carries the heavy weight in the coordination of benefits. In this scenario, Medicare moves to the secondary position. But what happens if the group is smaller? If that employer has fewer than 20 employees, the scale tips the other way. In these small group exceptions, Medicare remains the primary payer. Precision in order of benefit determination depends entirely on verifying this headcount. Are you confirming the employer size through employment verification before you finalize the primacy? You must. This single data point defines who is responsible for the bill and prevents recovery errors before they happen.
To ensure financial accuracy, we must establish the Order of Benefit Determination, or OBD. This is the foundation of our work. We rely on Medicare Secondary Payer regulations, commonly known as MSP. These are federal rules used to determine exactly when a group health plan pays primary and when Medicare takes the lead. What is our specific goal as auditors? We review claims where our client paid primary. We ask one critical question. Should Medicare have paid that bill first instead? Look at the flow. Once a medical service is rendered, the decision tree begins. Who pays first? That is the question of primacy. The primary payer holds the legal right and obligation to process the benefits first. The secondary payer only steps in to cover the remainder, up to the plan limits, after that first payment is finalized. Why is this distinction so vital? Because if the order is wrong, the payment is wrong. If we identify a claim where the client paid as primary when they should have been secondary, we have identified a recovery opportunity. Accuracy in OBD ensures that the right entity pays the right amount at the right time.
When is Medicare secondary for an aged beneficiary? Primacy is determined by 3 specific criteria. If even one is missing, the coordination of benefits shifts. We must see all 3 met simultaneously to identify a working aged status. First, look at the beneficiary's age. They must be 65 or older. Second, verify the entitlement. Are they entitled to Medicare Part A specifically because of their age? If the entitlement is due to disability or end-stage renal disease, different rules apply. Third, we examine the current employment coverage. The member must be covered by a group health plan through current employment status. Does the beneficiary have to be the one working? Not necessarily. This coverage can be through the beneficiary's own employer or through their spouse's active employment. Notice the crucial distinction at the bottom. Why is current employment status the key driver? Because the moment a member moves to a retiree plan, the logic flips. Retiree plans function differently, often making Medicare the primary payer. Our job is to verify that the employment is active and the employer size meets the threshold. If they are 65, entitled to Part A, and still actively working under a GHP, Medicare stands in the secondary position.
Once working age status is confirmed, the deciding factor for primacy is simple: employer size. Think about the standard rule. If an employer has 20 or more employees, who pays first? The group health plan. In these scenarios, the GHP is primary and Medicare is secondary. Why is this threshold so critical for our audits? Because it determines the entire logic of the claim build. If that employee count hits 20, the employer's plan is legally obligated to take the lead. We aren't just looking for active employment. We are looking for the scale of that employment. 20 is the magic number. If the count is 19 or fewer, the order reverses, and Medicare becomes primary.
But when we see 20 plus, the GHP stays in the first position. Every rule has an exception. In Medicare Secondary Payer logic, the working aged rule depends entirely on group size. Take a look at the threshold, 20 employees. If a member is 65 or older and working for a small employer with fewer than 20 employees, who pays first? In this scenario, Medicare is primary. The group health plan, or GHP, moves to the secondary position. Why? Because federal MSP mandates that shift costs to private insurance typically only apply to larger group health plans. Small employers are exempt from this specific cost-shifting requirement. When you are auditing a file, you must verify the employee count. If that count is 19 or lower, your primacy determination is clear. Medicare leads the way. This is the small group exception. Don't let the working status mislead you. The head count is the deciding factor. The 20-employee rule seems straightforward, but multi-employer plans change the math entirely. What happens when a small business joins forces with a large corporation under one health plan? Look at Company A. They only have 5 employees. Under normal working-aged rules, Medicare would be primary. But look at the structure of this group health plan. Company A, B, and C are all small. However, they are linked to Company D through a multi-employer group plan. Because Company D has 250 employees, they exceed the 20-plus threshold. That one large employer triggers the rule for every single member in the group. This is the one triggers all logic. If at least one employer in the plan has 20 or more employees, the GHP is primary for everyone, even for the member working at Company A with only 5 employees. Why is this nuance so critical for your audit? It means you cannot determine primacy based on a single employer's size in isolation. You must identify if the plan itself is a multi-employer arrangement. If you see a large group presence, the GHP stays primary, Medicare remains secondary. Accuracy in these nuances prevents us from incorrectly shifting liability to Medicare. Always look for the larger connection. One large member changes the rules for the entire group. Primacy isn't just about age, it's about the size of the employer group. Look at Scenario 1. The member is 65 plus and actively working. Their employer has 25 employees. Since that count is 20 or more, the group health plan, or GHP, takes the primary position. Medicare is secondary. Now, what happens when the business is smaller? In Scenario 2, we still have a working member aged 65 plus, but look at the employee count, 15. Because the employer has fewer than 20 employees, the rules shift. Medicare becomes primary, and the GHP moves to secondary. If you see a small group like this in the tracker, Medicare always leads the way. What about dependents? Scenario 3 shows a member aged 65 plus who is covered under a working spouse. The spouse's employer has 50 employees. Does the rule change because the member isn't the one working? No. Because the group size exceeds 20, the GHP remains primary. Medicare pays second. When you audit these files, the employee count is your most critical data point for the working aged. Have you verified the group size in the system yet? Always confirm that number before you start building claims. Accuracy here prevents a massive volume of rejections. The group size desk field is the engine behind our primacy determinations in the tracker. It tells us exactly how Medicare perceives the employer group. This single selection dictates whether the group health plan or Medicare pays first. Look at the first option, less than 20. If a company has fewer than 20 employees, who is the primary payer for a member with age entitlement? Medicare is primary. In these small groups, the group health plan is not required to pay first for those 65 and older. Now consider the middle tier, greater than 20 but less than 100. This is a dual-purpose category. For working agent members, the GHP is primary. However, for members under 65 entitled due to disability, this is still considered a small group. For those disability cases, Medicare remains primary. Finally, we have greater than 100. This is the large group category. Here, the GHP is primary for both age and disability. Accuracy in this field is non-negotiable. If you select the wrong group size, you have fundamentally broken the logic of your audit. Before you save, ask yourself, does the group size listed here match the verified count we received from the employer? Your entire claim build depends on that single dropdown.
When we identify a member who is age-entitled but working for a small employer, documentation is your proof of primacy. Why does the number 20 matter so much? Because if the employer group has fewer than 20 employees, the standard working aged rule flips. Medicare becomes primary, and the group health plan becomes secondary. The small group age template is designed to capture this specific logic for the audit trail. Precision is vital here. We don't just state that Medicare is primary. We list the exact effective dates for both Part A and Part B. Notice the requirement to document how the member is currently listed within the Facets client system. Why do we include this? We include it to highlight the discrepancy we are correcting. If Facets shows Medicare as secondary or not listed at all, our documentation explains exactly why that needs to change, based on the employer size. The middle section of this template is where you solidify your findings. You must record the name of the Medicare representative you spoke with and the date of that conversation. This transforms a simple note into a verified auditable record that confirms the small group status. Finally, we address the MBI. Even if the representative was unable to provide the Medicare beneficiary identifier, we document that the attempt was made. In an audit, showing your process is just as important as the data itself. Follow this template to ensure every small group case you handle is airtight.
Medicare is primary. In a small group setting with fewer than 20 employees, who pays first? Medicare does. When your investigation confirms this scenario, you must update the tracker with absolute precision. Look at the required fields. First, set MedPri to Y. Next, enter the effective date. This is the exact date Medicare became the primary payer. Why is this specific date so critical? Because it dictates which claims we can legally bill for recovery. One wrong day can invalidate an entire audit. Under Status, you will enter 513. This code tells the system and the vendor that Medicare is primary and the coordination of benefits, or COB, is complete. Finally, your note must be detailed. State the plan type, confirm the Part A and B effective dates, and list the exact number of claims billed, along with the total dollar amount. If the documentation isn't in the note, can we prove the audit was performed correctly? Precision in the tracker ensures our findings are defensible.
To validate the financial impact of a COB error, we must isolate the spend that occurred during the overlap. This is how we determine the specific dollar amount at risk. Look at the column for COB_NDOS. Why do we focus on the end date of service? Because the completion of the service determines which payer is responsible. In this example, Medicare coverage began on June 1, 2024. To find the overlap, you will apply a filter to the COB_NDOS column. Select Date Filters and then After. Enter the Medicare effective date, 6/1/24. What does this tell us? It clears away any claims that were correctly paid while the plan was primary. Now, look at the resulting DONDA line values. When you sum these filtered claims, you arrive at the spend since Medicare. This is the total amount the vendor will target for recovery. Accuracy is vital here. Notice the note on split entitlement. What happens if Part A and Part B have different effective dates? You cannot sum them together. You must filter and sum the spend for Part A and Part B separately to ensure the audit reflects the exact window of Medicare's primacy for each benefit.
When a member reaches age 65 but chooses to keep working, we must determine the primary payer. The logic rests entirely on employer size. What happens when that employer is small? If the company has fewer than 20 employees, Medicare is primary. You will bill these claims as Medicare first every time. But what if the company is larger? For employers with 20 or more employees, the group health plan, the GHP, is primary. In these cases, Medicare steps back into the secondary position. This rule also applies to multi-employer plans. If at least one employer in the group has 20 or more employees, the GHP remains primary for all members of that plan. Look closely at the footer. You must verify active versus retiree status before applying this matrix. Why? Because if the member is retired, these employer size rules no longer apply. For retirees, Medicare is almost always primary. Accuracy in employer size is the difference between a valid lead and a provider dispute. Always confirm the employee count before you finalize your primacy determination.
To perform a precise audit, we must first master the language of the industry. These terms are the building blocks of every claim we build. GHP, or Group Health Plan, refers to the commercial coverage provided by an employer. In our world, the GHP is the entity we are often comparing against Medicare. MSP stands for Medicare Secondary Payer. These are the federal rules that dictate primacy. When you are auditing, you are essentially asking, under MSP rules, who is the primary payer? The answer to that question gives us our OBD, or Order of Benefit Determination. This is the specific sequence of payers, who pays first and who pays second. Now, look at the distinction between active and retiree status. This is the pivot point for many of our findings. Working-aged rules apply only to active employees. If a member is retired, Medicare typically becomes the primary payer, shifting the GHP to a secondary position. Do you see how a simple change in employment status completely flips the order of benefits? When we analyze the data, we look at lag. This is our look-back period, typically 90 days. We respect the lag to ensure claims are fully processed and finalized before we begin our review. Finally, we track the spend. This is the total sum of the members' paid claims. When you report your findings, the spend is the hard data that proves the value of the audit. Accuracy in these definitions ensure accuracy in our outcomes. Let's keep these definitions sharp as we move into the logic of the audit.